Hello, family. Welcome back to Life Reconsidered. Once again, with your girl, Dr. T. Today, we want to continue our conversation about how to help a family member or a friend with mental health disorder. And our attention is going to be on people struggling with substance abuse disorders or addiction. The first thing that you want to be cognizant of are the signs and symptoms of addiction. Now, there are three categories. The first category is the behavioral and social symptoms of addiction. This is when a person becomes very secretive. They continue to lie and be dishonest about who they are with, where they went, what they are doing, and they close up on everything that they are doing. If it's a student, they no longer care about their performance in school. So if the student started as an A student or B student, they no longer care and they end up being like a C or D student. If it's an adult, in addition to poor performance, maybe at their workplace, they also tend to draw from responsibility. They no longer become committed to the things that are important to them. They don't care anymore. The second category of addiction symptoms is the physical signs that you see. With a physical sign, people tend not to care about, how they look. They don't care about their ADLs anymore. And when we talk about activity of daily living, which is ADLs, eating, bathing, cleaning, their hygiene, so to speak, they no longer care about that. When the person begins to put away and not committed to their ADLs, you want to pay attention and try to find out what are the possible reasons why the person is no longer caring for their ADLs. The third category are the psychological symptoms of addiction. With the psychological symptoms, we are talking about mood swings, irritability, anger, defensiveness, low self-esteem, with or without the substance, a sense of hopelessness. So when you begin to see some of these psychological symptoms, you want to also pay attention and try to find out any red flags in the person's behaviors and attitude. The second thing you want to do is to try to find out resources in your neighborhood or in your community. Now, there are different resources for different substances. For example, if somebody is addicted to alcohol, they can attend the Alcoholic Anonymous group, which is an outside group. It's a 12-step program and is considered a faith-based program. Now, if that person attends the AA group, they are assigned a sponsor, and that sponsor walks along with them to help them to find out what are their triggers, stresses, and they can also come up with a relapse prevention plan, which will help them to stay on course in their recovery process. If that person is struggling with, like, for instance, meth, there is also Methamphetamine Anonymous group. There is also Marijuana Anonymous group, and there is also the Narcotics Anonymous group. Another group that is so helpful for both people dealing with substance abuse disorder or addiction and with your family is the National Alliance on Mental Illnesses. Now, for short, they are called as the NAMI. So if you Google NAMI, NAMI, and you contact them, they have so many different resources across the state. They'll be able to connect you to resources available, whether it's for a family member or friend struggling with substance abuse, or for yourself who want to be the support person, and they will help connect you to those groups. There are also some faith-based groups that have shown to be very prominent in terms of people's recovery. And one of those faith-based groups that I highly recommend is Celebrate Recovery. There's also the Christian Recovery. And like I mentioned, AA is also one that, most faith-based people usually tend to as well. Now, if it's for you as the support person, like I mentioned, you can contact NAMI and they will connect you with resources out there for you as a support person. Some of the groups you can join are also the NANON, NARANON, NANON, or the Al-Anon group. These are two main groups that will help you to understand what your loved one is going through. That way you'll be in a better position to support them. Now, the next thing you want to do, now that you understand the signs, the symptoms, and you know the resources available, you want to create an intervention. Now, if you haven't done so already, creating an intervention can be very tricky because sometimes your family member can deny the fact that they're using substances. So in terms of creating an intervention, the first thing you want to do is do it by yourself first. And if it doesn't work, then you can set up the stage for inviting loved ones as the next phase of your intervention. On a subsequent time, it doesn't have to be the same time. So when you call your loved person, let them know you are concerned about them. Express your concerns and the observations that you have noticed. Any changes, any symptoms, like we discussed earlier, any signs and symptoms from these three categories. Let them know that there are resources available to support them and that you are going to be there through their recovery journey. If they become defensive, don't be angry at them. Don't be judgmental. Don't be resentful. However, continue to express your support. Continue to let them know that you care. And in the meantime, continue to gather resources and information on how you can support them. If they end up coming back to you, great. You already have the support, the resources available to help them walk their recovery journey. Now, in terms of treatment for substance abuse disorders, there are different types. One, there is the social detox. The social detox can be used for people who are addicted to alcohol, who are addicted to any forms of drugs. For instance, in a state where marijuana is legalized, it becomes very difficult to justify medical necessity to detox from marijuana. However, you can still find help and support that you need. Apart from the social detox, there is also medical detox for people to detox from alcohol with complicated medical conditions, or for people who are using multiple substances which complicates their withdrawal process. So that is medical detox. After a person detoxes, either social or medically, they can have a continual treatment process in what we call a rehab. So in a rehab center, some could stay up to about 3 weeks, 4 weeks, 6 weeks. It all depends on the plan of the rehab center and how long this patient is able to afford in terms of your treatment. Some insurance will pay for, rehab or detox, medical or social, if they meet that criteria. So it's important to know all these different types of treatment out there before you have an intervention, so that when your loved one is open to treatment, you know what to do. It is hard to find them motivated and to tell them to wait for you, so you now go find resources. By the time you come back, they may not be motivated again. So understand the symptoms, find out the resources, be knowledgeable about treatment out there. And once you find them motivated, you can now connect them to treatment centers. In terms of medication for addiction or substance use disorder, there are different categories, but it all falls under what we call medication-assisted therapy, MAT for short. Now, if somebody is addicted to alcohol, some of the common medications that can be used to decrease their cravings for alcohol are acamprosate, disulfiram, which is also known as Antabuse, or they can also use naltrexone. So these are common medications that can be used to help someone who is addicted to alcohol, or it can also be alcohol in something else. So these are the common medication in that category for alcohol use disorder or alcohol addiction. Now, when somebody is addicted to opiates, there are also different medications that can be used to help to decrease their cravings towards that opiate. Now, for instance, you have buprenorphine, which can be found in either Subutex or Suboxone. And you can also have methadone and again, naltrexone. So these are also the category of medications that can be used to help somebody who is addicted to opiates to reduce their cravings. Now, in the event that somebody overdoses on opiates, experts will normally use Narcan. So the Narcan will help to reverse the person who has overdosed back to instant withdrawal. So if you have a loved one who is struggling, I would recommend that talk to professionals or talk to a mental health provider or talk to your psychiatrist and see if they can walk you through how to use and administer a Narcan at home, or better still, just have the knowledge and it will come handy for you. Okay. All right. Now, the last two things that you want to do is that you want to ask questions which are pertinent to the situation of your loved one or friend. You want to understand what they're going through and what the triggers are, what their stresses are, and how they got to the point where they got to. If it's in the early stage of the addiction, you also want to help them and understand, where they are and why they started using the substances. Please, again, have empathy, be non-judgmental, and help them, connect them to resources, and also be supportive. If it's outpatient therapy, you want to be there, support them, drive them there, and try to encourage them to come around you, invite them for programs so that they are not isolated, because sometimes isolation and boredom can lead to an increased use of the substance. Last but not the least, don't forget to pray with them, pray for them, support them, love on them, But most importantly, don't be an enabler. If you understand the situation of your friend or family or loved one struggling with addiction, you want to know the difference between being supportive and being an enabler. You want to be supportive, but you don't want to be an enabler. An enabler is helping your loved one make excuses for what they're going through, and also giving them extra resources, like money or substance available to them. I've heard some parents say, if you want to use, you can use at home where I can see you. Now, like I said, you want to be supportive, but you don't also want to be an enabler. So it's important for you to have a healthy balance. And one way you can know if you were supportive or being an enabler is to attend some of these loved one support groups that I talked about, so that you can hear other people's story, you can share your story, and you'll be well informed to support your loved one. This is it all for today. If you have any questions, please don't hesitate. Contact me through my email at mylifereconsidered.gmail.com, and I will be more than happy to point you to your direction where you can find resources and how you can be a practical support to your loved ones. Thank you for joining me today. See you another time. Bye.